Welcome to Dialogue. I'm Hamid Shirvani, President of California State University Stanislaus, and your host for this program. Dialogue features interviews with community leaders, elected officials, faculty, students, and friends of the university. Today I'm pleased to be joined by Dr. Moses Elam, a dermatologist who is also the physician-in-chief for Kaiser Permanente's Central Valley service area. Dr. Elam oversees the physicians and medical operations of the medical centers in Modesto and Manteca and 6 medical offices in Modesto, Manteca, Stockton, and Tracy. These facilities serve more than 250,000 Kaiser Permanente members. Dr. Elam and Kaiser Permanente have been great friends to the CSU Stanislaus. They helped sponsor many of the community programs, including a recent $250,000 contribution to our nursing education program. Dr. Moses, it's a pleasure to have you on this show.
Thank you so much, Dr. Shirvani. Thanks for having me.
Tell us a little bit about yourself and how you ended up with Kaiser Permanente.
Yes.
As a well-known dermatologist.
Well, I'm a little bit of a transplant. I'm originally from New Jersey. Actually went to high school in Linden, New Jersey. Did my undergraduate education at Howard University in Washington, D.C. Came back to New Jersey to go to medical school. I went to the University of Medicine and Dentistry in New Jersey and actually did my medical internship at the University Hospital. And that was important because at that time in Newark, New Jersey, this was the first new hospital that was occurring again in Newark. And so I was sort of one of the first residents in that hospital. And so that was pretty exciting at the time. Subsequently, I had the opportunity to do my dermatology residency at Cornell University and Medical Center in New York City. And then from there, went back out and began a fee-for-service practice in both New Jersey and New York.
Can we kind of divert the conversation? Linden, New Jersey, isn't that there's a good diner there?
There is a good diner there, absolutely. They have some of the best hamburgers, and when I go back, I make sure I stop every time.
I agree. Let me ask you this question that naturally Kaiser Permanente is a huge corporation. So when you're part of these very large, complex organizations, sometimes things turn into be a little bit of bureaucratic. And for a person like you that I know, you are extremely committed to your work and you want things to be done fast and with high degree of quality. How have you been able to, or maybe Kaiser is different organizations, so tell us about
Well, I think you're right on both occasions. Sometimes when you're large or when you're big, it certainly could seem like you could also be impersonal. But I think as an organization, we have taken really great pains and great strides in delivering very personalized care. I can tell you that a number of years ago, we actually took our doctors through a course on personalization of care, recognizing that we could be perceived as being large and bureaucratic and impersonal, as well as we've looked at how technology interplays with care delivery, that if you're not careful, the patient can seem to sort of be an aside in the patient exam room as opposed to the focus. And so we really spent a lot of time training, talking to our physicians, and making sure that as they deliver care to a patient and utilize all the tools that they have around them, that all care is personal. And patients want that kind of relationship when they seek care.
When I go to, and I do go, as you know, to many hospitals because we have relationships, but when I go to some of the Kaisers, as many of them as I've gone to, is just when you enter, first of all, the places are really clean, and the first person that is a point of contact has a smile on, which these days are very rare. So I have to compliment you on that. But what would you tell us some more kind of innovative things that you're doing in Kaiser?
One of the things that we actually measure is we've asked our members what it is that they desire and what they want. And very clearly, they told us that, again, having their own physician is really, really very important. And we believe certainly that our members having their own physician obviously is very important to their care. So that's actually something we measure. We actually have metrics to tell us how many of our members have their own physician. When we get a new member, we actually look to enroll them with their primary care physician within the first 60 days of becoming a member with Kaiser Permanente. So we really take it very serious. We recognize that, again, all care is personal, and we want our members to have a primary care physician that is of their choosing. And so that's very important. As you talk about information technology, certainly, again, the ICANN report, and I think most people recognize that we really are at the cutting edge and at the forefront of using information technology to better serve our patients. There are probably three things or three groupings that I could talk about that I think really speaks to this area. One is our model of care. We are what's called an integrated model of care, and I'll be able to explain that to you some more. But one of the other aspects of not only being integrated, but we are information technology savvy. We have spent $1 billion or more on our information technology systems. And I think it was March of 2009 is when we became the largest medical group in the country to have an electronic medical record that would allow us to basically have have access to data on our patients, both in the outpatient arena, the inpatient arena, the emergency room, and so that, as I say to many of my physicians, the patient can never get lost now. We have full access to all of their records, including lab, pharmacy, Stentor for radiographs, and really this has been a differentiator for us as we look to deliver care differently. We think 21st century healthcare really will need to utilize information technology systems in order to be more efficient, but just as effective in delivering care.
That's wonderful. So, this is very much about this electronic records and how important it is in terms of for patient and for care of the patient, but also it's very important for insurance companies who are paying for the medical bills. And also a lot of the consumers or ordinary people in the middle getting caught between what kind of information and when it has arrived and so forth. So in fact, I'm pleased to report that there are faculty working, at least a couple of faculty are working on developing a master's degree in health informatics that apparently there's a high demand. So could you tell us, first of all, what are you doing at Kaiser, which of course with all this investment, and second of all, this is also a healthcare kind of debate in the Congress, the same topic. So elaborate on that, please.
Well, we certainly know that personal health information is very private. There are a lot of laws and regulations surrounding health information. We make and take great pains to make sure that our medical records and medical information is safe and compliant with all the laws and state regulations. And so, again, that's an investment that we've made to make sure that we have, the proper kind of health informatics, that allow that to happen, and patients can feel very comfortable that their information is complete, but also safe. We've been able to really use, technology in ways that really other organizations have not been able to do so. We've used health information as a way to really provide greater access to our members. We could have a member that lives here, in the Central Valley and perhaps is in the Bay Area, and if they become ill or have a need to see a physician, they can see someone in the Bay Area, and yet we have access to their records here in the Central Valley. So again, this provides really a 24/7 operation for us to have access to a member's record. Also, we are doing some very specific things around taking care of patients, using our health information systems. We have an initiative that allows both the primary care physician and the patient to be in the office at the same time, but also now actually have a specialist on the phone while the patient is in the office. And what we've found is that when we have the specialist sort of in the room at the same time, this really allows us to meet the needs of the patient in ways that we could not before. Rather than have a patient now have to potentially leave the primary care physician's office and see a specialist, we actually now can have them talk to the specialist with the primary care physician. And during that kind of conversation, the specialist can offer opportunities, consultative opportunities, to really further delve into the concerns of the member, so that if there's additional testing that needs to be done, the specialist can actually do that while the patient is still in the room. And many times what we found is that with the specialist in the room, there are many times now where the referral is not even needed to be generated to the specialist, because the specialist has heard the complaint. The specialist is able to actually have the benefit of the physical exam of the primary care physician, and we can really get the healthcare needs of that member met many times without the person ever going to the specialist. But certainly there are still times when the patient will need to see the specialist, and the opportunity for the specialist to ask for additional testing if needed now means that when the patient goes to see the specialist, they're going with all the information needed for the specialist to meet their needs, as opposed to going, perhaps the specialist will say there are additional tests that are needed, and then the member having to come back again. So we think that this really is a service not only to the physician, but more importantly to the patient, because now we're not getting additional appointments to a physician, potentially additional co-pays or deductibles to a physician. That really is not necessary. It is trying to reduce a lot of, I think, the redundancy that does exist again in medicine. Again, as we have a full electronic record, unlike the community, if you go to a physician, if he does testing, and if 3 weeks later you go to another physician, they are most likely to do very similar testing because they have no access to those records.
So what essentially you're saying, I go to X specialist, he or she has access to my record, then refers me to the another one. Okay, when I go to second specialist, that person, before I walk in, has identified all the problem, has read it, and even if he or she feels necessary, before I go, will ask me to do certain things. So that can save several trips.
That's exactly right. At the same time that the patient is in the room with the primary care physician viewing the record, you have the specialist remotely viewing the record at the very same time.
These days we do everything online. We're really promoting online education, online courses, online degree programs. A lot of things are online. Are we, or have you, is Kaiser moving in that direction, or the medical industry, to some of these healthcare issues being online? So I can, let's say, I'm a patient, I communicate with you online, what's my problem, and can you help me?
That's right, Ham. I know you do a lot of traveling, and I'm sure you don't go to check in and buy your ticket. You get it online.
Absolutely.
Again, there are probably so many people now who do their banking online. So I think as we look at, again, 21st century healthcare, there's no question that we have patients and members who, again, are looking for us to deliver a certain amount of care when possible online. And so, again, we have really put a lot of resources into our online tools. And so we have our members, our patients, who can really access their physician online. They can access their labs online. They can make appointments online. They have health education information online. And so it really is an opportunity for us to streamline care, to make care more convenient and make care more efficient, again, to a patient, again, who has a need to want to maybe have access to information and yet not need to come into a physician's office. So yes, I think developing the kind of online services that we have really been tremendous. Patients can go and take certain health assessments online that, again, will help us to develop plans of care around, again, any particular medical condition that they may have, but even around things such as nutrition and even exercise. So yes, we think that having online services is very important, very critical, and that patients really want access to health information today.
Great time to tell our viewers about the wonderful partnership that we are beginning to implement with Kaiser Permanente School of Allied Health in our Stockton Center. We're really pleased to report that very soon Kaiser Permanente School of Allied Health will be offering certain specialized certificate program in, for example, sonography or radiology technology and many other areas. But in conjunction with us, with our partnership, and of course, as we move towards more health sciences programs in both in Turlock campus as well as Stockton campus. So that's a wonderful and very unique partnership. And that's all I'm going to say about it, because the rest of it will come after November, where we're going to launch this. But I just wanted to give you a prelude of
Well,
that.
you need to let me say more. Number one, I want to thank you for your vision and for your leadership in this area. And I think as we are organizations in our community, we certainly also look to improve the health and education of our communities. So I think this partnership is a great one. When we look at our communities and some of the economics, we know that we're sort of in an agribusiness area. And we have young people that need jobs. And when we look at the uncertainty of the economy, I think we all know how we've been affected as we look at double-digit unemployment rates. Stanislaus County and San Joaquin County really have been hit very hard. So I think the idea of being able to have an education program for our youth once they graduate high school so that they can obtain a job, particularly in a health career, is one that is really tremendous. As you know, we had a facility, if you will, in Richmond, but
Right.
to be able to put a campus now through partnering with Cal State Stanislaus, you and your leadership, is really a great service for this community as we look to know that actually health careers are really very important to our communities, because some of our largest employers are either our education facilities or our health care delivery facilities.
Absolutely. There is no doubt that, particularly us that are baby boomers are getting older, and the generation even after us is getting older, and health sciences are really drastically advancing. So we're going to age longer, and therefore we need more care. And also healthcare is getting much more sophisticated, as you were eloquently, teaching us and telling us about these great things that are happening.
We know there is a healthcare facility that is coming to our area in the near future that really is going to have well over potentially 1,000 patients. And so again, in order for us to really get ready for that facility and to have the kinds of, again, jobs as you stated, whether you're a phlebotomist, a ultrasonographer, or radiologist, or radiology tech, again, it is important that we have programs that will allow our youth and our young people to be ready for those jobs when they come.
In the state of California, we're short of medical professions, skilled people in medical professions, with quite a large number. And so whatever we do to produce, and we are very committed at CSU Stanislaus to increase the number of these skilled healthcare professionals.
I think we sort of recognize that here in the Valley, we sort of have to grow our own to a degree.
Absolutely.
So again, I think it is important that we can partner together and offer the kind of programs that again, will allow our youth to find the opportunity for jobs and be productive and constructive members of our society.
Well, let's move a little bit away from Valley and even Kaiser and Permanente, because we have the golden opportunity to have a distinguished physician and a scholar like you here. What do you think of this? There's constant debate about this national health care. And I'll tell you, before you answer, I tell you my bias is, I grew up in London, and there was national public health, and it was just wonderful. President Obama presented this healthcare plan and so forth. It's a lot of talk about it. It's like the past 3 decades we've been talking about it. Where are you, Stan? What do you think about it? What's your reflections?
Well, I think, probably the biggest thing is, how do we have an honest conversation about healthcare? How do we sort of outline what the real issues are? We know issues of cost is certainly a concern amongst purchasers and employees. Along with that, there is a concern about quality of care that is delivered for the cost that you're spending. What is the value of that care? And then there is an aspect of the number of uninsured individuals that are in this country as sort of the greatest country, again, in the world, that we could have so many people who, quote unquote, don't have insurance. And I think I think the issues and the problems are multifaceted. And the question is, how do we have an honest dialogue and a discussion about those areas? The Institute of Medicine, I think in 1999, in its signature journal, really talked about the issues that we faced around care. And what the article basically outlined was that a lot of the care that is given is actually not even the right care, the best care. And it actually was somewhat of a indictment of us as providers of care, is that when we look at the number of times we deliver the right care, it isn't even 50% of the time.
Oh my.
So I think as we look at cost, and as we look at organizations who are looking at quality in this country, there are a lot of great questions that need to be answered. And I think everyone recognizes that, again, healthcare is not cheap, but are we getting the right value? And I think that, again, has really been a question on a lot of people's mind. I am reminded of just last night on Fox News, I actually happened to see a Mike Cannon, who's from the Cato Institute, and they were talking again about readmission rates and how do you have people who are discharged from hospitals right back within the hospital in the next 2, 3, 4 days within a week's time. And when you look at that cost on the system, what can we do, or how do physicians and providers of care, how can they intervene in that process? And what is the process? And as an organization, Kaiser Permanente has really looked at that process. And we have found numerous ways in which we can intervene sooner and at the time of discharge of a patient from the hospital to try to make sure that they don't return to the hospital inappropriately. And we know that if they can get an appointment with their primary care physician, again, within 3 days of being discharged from a hospital, if we can make sure that their medications have been reconciled and that the caregivers and family members sort of understand the plan of care for that patient, that we can reduce those number of readmissions. And I can tell you that the Centers for Medicare, they're looking, again, at things like readmission rates, and they're actually taking some stands in terms of how they're going to pay for readmissions in the future. And so I think all hospitals, all organizations are really going to have to look at how we're delivering care, again, on the inpatient side, and try to figure out better ways, again, to number one, take care of patients more efficiently and effectively while they're in the hospital, but then once they're discharged, make sure they get to the right venue so that their care can be continued, monitored, again, so that we can make sure that patients don't wind up back into the hospital.
Well, that's fascinating what you're saying, because I look at an exemplary institution like Kaiser that is a nonprofit and yet striving and, quality health care and so forth. But then, I look at myself. I went for one procedure in 2 different places, not Kaiser. One, a surgery center, one, a hospital. Same thing had to be repeated twice for whatever reason, which we're not going to waste the time here. But one place charged $2,000 for surgical facility. One person was more than $10,000. And the insurance pays both of them. I mean, it couldn't be simply, in France, in Germany, there is a very clear standard. This costs this, that costs that. I know there are some people get very upset when you want to, kind of regularize these things, but isn't this happening in certain organizations very clearly?
Well, strategically, I think we've been pretty good about looking at how we can meet patients' needs, and we have a sort of one-stop shopping kind of mentality. If you go to most of our facilities, our patients can get their needs met, whether it's going to the physician's office or getting a radiology test performed or going to the pharmacy. Again, within the same facilities. Not all our facilities, but the majority of our facilities have that. So we do think that that's really very important to be able to have facilities, again, where patients can sort of receive all of their care. And then you sort of goes back to having an electronic medical record that, again, doesn't allow the patient to get lost. We know what happened in the outpatient. We know what was prescribed. We know what happened in the radiology area. This does make care more convenient as well as efficient and effective for members. And so again, we think that the integrated model of having both primary care and specialists, again, on the same team for the physician is really a plus for the member, for the patient. We think having a health plan, a hospital, and a medical group on the same team working and aligned for the benefit, again, of the patient is really a winning strategy and a winning team. It's Atul Gawande, a New York columnist, wrote an article in the New York Magazine that talked about cowboys versus pit crews. And basically, to summarize, he was saying that what we need in healthcare today is really a team approach. Again, the way we used to practice medicine 20 or 30 years ago as a physician, sort of out on your own, staying in the hospital late, trying to make sure everything was taken care of, that was okay for a time when medical information, knowledge, and even instrumentation was at a certain level. But today, with all the wealth of science and new information, technology that is available, it takes more than one person to really deliver great care to any patient today, particularly at a day when many patients have a lot of chronic conditions and comorbidities that really can make it extremely difficult for any one person to take care of a member. And so again, having primary care specialists, on the same team, we really think is a winning opportunity. But also how we're structured. Again, having an insurance company, having hospitals, and having a medical group all looking forward and aligned around how we deliver care to our members, to our patients, we think also is very critical and very important so that our incentives are aligned. We are a medical group of physicians who are salaried. And so when we go into a room to see a patient, only thing we have to focus on is what is medically needed and necessary for that member. When I was in fee-for-service, I had overhead I had to pay. I had staff, I had receptionists, I had nurses. The truth of the matter is you had to make sure that you could generate enough revenue for not only your own take home, but also to pay your staff. And I think, again, having salaried physicians is the right incentive. Again, I only have to worry about taking care of the medical needs of the patient.
Absolutely.
And I don't have to worry about over-testing or under-testing, because also as a medical group, and again, when you talked about being sort of a large medical group organization, we're not bureaucratic in the sense that the medical groups makes all the medical decisions. We don't have administrators or anyone else telling us what to do or how to do when it comes to care of our patients.
Absolutely.
It is simply the physicians, again, doing the right thing for the member, for the patient. And we think that's really critical. And that really gets back to why we as physicians went to medical school, was to really concentrate on the health and the interdiction and intervention into disease and disease processes so that we can keep patients healthy. And we believe as an organization, as we do that, as we focus on quality and prevention, this is what down the road, long term, I believe will be to a lowering of cost, again, in our industry. And so, again, prevention, interdiction, chronic disease management programs that we have as an organization, I think really gives us a leg up on our competition and really on the old cottage industry of, I'll call, sick care. Again, if you really think about it, the way that medicine had previously been practiced, you really only went to a doctor when you got sick. So where is the opportunity for prevention. And wellness? And that is something that we have always had as an organization, has always been in our DNA for over 70 years with Dr. Sidney Garfield and Henry J. Kaiser, as they really sort of made the organization of prepaid healthcare one that really could be a great success.
I really appreciate it. I think for me it was quite educational, because what you're really saying is that not only about this Kaiser healthcare model, but the national debate has to move to a more, when you say honest, is that let's forget about the bureaucracy and processes and all the policy thing. Get to the patient and get to the substance, and then build it based on medical needs and medical processes. Build the other model on top of that. How do we serve the patient better in the least with the least cost?
Absolutely.
So that's really I really appreciate it. We're really run out of time, but before we close, Dr. Moses Elam, tell me about, I know you're a big golfer, but you're also a car fan. Is that true?
I am.
Okay.
I try to get out, not always once a week, and once a week for most golfers know that that's not enough. But just to be able to get outside in the outdoors and to try to hit that little white ball is certainly a lot of fun and very challenging.
That's
and so I certainly do love that. And cars are always nice. I think I got to see a little car that you had that I really, really enjoyed and really liked. And, as people I think who, and I know you do, work hard, I think everyone needs to have hobbies or things that they like, again, that helps them to perhaps not think about always the work that you do. I think, and I'm really glad to say that I have a job that I really enjoy, as a dermatologist and both as an administrator, to be able to work with 420 doctors, 1,500 staff, to be able to deliver health care to 260,000 members across the Central Valley, to be a part of an organization that has built new hospitals in an area that hadn't had a hospital in 40 years, to be able to, again, have facilities that patients can go to that are close to where they work or live. Really is a opportunity for me, is a career opportunity. It is one that I am blessed with and I think about every day, and I'm really very fortunate to work with so many great people who simply want to be their best and do their best. We want to be able to deliver great care, again, for patients and to our members, and I'm just very fortunate to have the opportunity to do that here in the Central Valley.
We're delighted, and I have to come and maybe carry your bag or on the golf course to learn a little bit about you. So thank you so much. Delighted to have you on this show.
Thank you so much for having me.
Great educational time for me. This has been Dialogue. I'm Hamid Shirvani, President of California State University Stanislaus. My guest today has been Dr. Moses Elam of Kaiser Permanente. Please tune in next time when I will welcome another guest positively influencing our region and community. And thank you for watching.